I've been a diabetic, I think, since 2009. Um, my weight has been like a roller coaster, up and down, up and down. About 3 years ago or so, um, I was talking with my doctor and my family physician, and he said, there's a program that might be beneficial to you, and I want you to give it a try. Next thing I know, Danielle is giving me a call, and there we go. And so that's how it all got started. But it was um, my family physician, Dr. Hambarish, knew I was struggling, um, and that involves some depression. Weighing at my heaviest about 7 years ago, about 380 pounds, and 7 years ago, I decided, it's time to really understand my diabetes, because I realize, and I've learned through Danielle and Ellie, that it's it impacts every organ, and if we don't start now, if I don't start now to start changing some poor habits, um, I'm gonna lose limbs, appendages, heart attack. I mean, it's just, the outcome is not good. So that's why I agreed to get involved. And the more I've learned, the more of my desire has been to make little changes here and there, and with my eating and my exercise regimen. And to date, I've probably lost about 100. I'm down to about 355. Um, I've gone from a 54-inch waist to about a 38, 39-inch waist. And I walk 25 miles to about 50 miles every week. And I've started riding bikes last year. My wife and I rode 20 miles on Saturday, and I rode another 10 yesterday. But it's just making little changes along the way. So I'm 61 now, and I'm probably in the best health that I've been in the past 30 years. So, but it all stemmed from my doctor and him mentioning the program, and then Danielle contacted me, and I said, absolutely, I need to learn more. I think it's truly understanding diabetes, because it's a scary word. Nobody, if you don't educate yourself, you're not going to understand it. But there are things that you can do to combat it. So I think for me, it was the focus on learning, but it was also, I mean, you know, I love rice. Well, I learned that, you know what, go to brown rice instead of eating white rice, because it breaks down differently and it doesn't have as many carbs as the white rice. So Jill and I, as a lifestyle with our those carbs, 3 years ago when we started this program, that's one change that we made, was we switched totally to brown rice. It cooks different, you have to get used to it, but it's better for you. So little changes like that, and eating more fruit, eating less of the junk. I mean, staying away from junk food, and just eating more fruit and veggies, and enjoying them, and learning to do the veggies different ways. And but it's just, I think they made an impact on me with the food groups, learning more and more about the diabetes itself and the organs that are impacted, but putting an emphasis on your life's not over. You know, let's start now, and you can change and impact the direction your um, diabetes. Just being prepared, having, like when I walk, I'm walking as many as, on Saturdays, 10, 15, or 20 miles at a clip. And you know, they instilled into me, take snacks that don't burn quickly, but will give you the protein that you need, will build your sugar back up, but then it'll last a period of time till your next stop. You can't discount family and friends and even people that are going through the same thing, because you can encourage another diabetic if they want it, if they want it. But my wife Jill has been a hero of mine. To, all right, you just ate a piece of candy, or you ate that a cup of ice cream, or was it more? I mean, so keeping me in check. I have her to keep me in check, but it's just having the encouragement and the accountability. All of that is positive, and I think that you have to have all of it. Everything I've said, along with accountability, um, and just knowing that we can live as healthy a life as we can, but it's going to take, like I said, hard work, dedication, consistency, and just do the best you can do. And then the best I can do might be different than somebody else, but it's the doing it is where we grab hold. It's taking that first step. It's making that first lifestyle change, like changing from white rice to brown rice. It's small changes along the way that, if you stick with it, that's where the big changes come. I don't know. It's just I think it's the importance, and when you're with Danielle and Ellie, it's fun. They make they're engaging, and they want you to learn. And I think the neat thing about it, in my groups, there were people from different economic standing, different education levels. You had every type of person in there. And so I think drawing from each other, we could encourage one another. But y'all's goal, what I gather, is to do what you've done with me: educate me, encourage me, hold me accountable, but want the very best for me so that I'll continue on a healthy lifestyle. And they really impacted my life. And I knew that, I mean, because they were genuine and they weren't fake, you can tell that they're real and they want to help you. Somehow, everybody who is a diabetic needs to go through this. This has literally saved my life. Okay. Um, and I think because I took it seriously, I think that that's why I'm having fun living again, because I did take this, every piece of it, seriously. But I think somehow there's got to be a tie in to more physicians, more hospitals, and they need to know the impact that this program can have in an individual's. It's working, but more people need to be involved, and they need to realize that they can't do it by themselves. They need somebody who understands it, understands the morbidities. They need somebody that will help hold them accountable, who will love them through it, like Danielle and Ellie have with me. Everybody who's diabetic, if they had opportunity to go through this program, um, it would give them hope. This program has impacted my life to where I'm the best version of Greg that Greg can be. And you guys help do that.